Thank you. Thank you so much for introducing this bill today. Good morning. My name is Patrice Winter. I am a doctor of physical therapy with more than 35 years experience treating persons who require rehabilitative care. I am also a member of the American Physical Therapy Association, and I am pleased to be here today to provide an important perspective about the need to end the practice of financially incentivized self-referral in physical therapy. Physical therapy is a vital service to help individuals regain their optimal function. When physical therapists provide care, it's imperative to ensure medical decisions are made in the best interest of the patient on the basis of quality, diagnostic capabilities, turnaround time, and cost without consideration of financial gain. Unfortunately, the trend in some healthcare has been to self-refer physical therapy services specifically for financial gain. This type of inappropriate utilization should be addressed by Congress, and APTA applauds Congressman Speer in taking the lead to fix this loophole. Physical therapy services clearly do not meet the original intent in the office ancillary services exception, and self-referral by physicians increase costs to Medicare and erodes patient trust in our health system. The IOAS exception was meant to be for services needed for patients' convenience that were integral to the original physician visit. But according to MedPAC, only 3% of outpatient physical therapy is typically provided on the same day as the office visit. Furthermore, physicians and physical therapists have a long-standing professional relationship that serves patients well without the need for adverse financial ties or relationships. In my experience, rarely have I seen a patient only one time. Physical therapy is a journey. There is dysfunction within movement. Physical therapists are the movement specialists, and we try to we're guides for people to achieve their optimal physical performance. And it might be in a athletic issue, or it might be just the idea of being able to get out of bed and brush your teeth. It takes time. It takes many visits. Early in my career, I worked for a physician-owned practice, and we had to have so many codes when we saw a patient. I opened, after just a couple years, I realized that my integrity was being compromised, and so I opened my own physical therapy practice. Saw patients considerably less and used less CPT codes. And so that's part of why I wanted to be here today. We know that there is a growing mountain of evidence to support eliminating physical therapy and these other services from the IOAS exception. The White House, Congressional Budget Office, the Simpson-Bowles Commission are among countless others who have looked at this issue and raised the red flag on maintaining the status quo. We all know that policy change is challenging, but it is imperative that Congress acts to preserve the integrity of the Medicare program and disallow the use of loopholes that only weaken our ability to reduce unnecessary costs and provide quality care. Those who oppose this legislation will claim that patients' care will be compromised if these services are removed from the IOAS exception. I disagree. With the way that the EMR, the electronic medical record, is such an integral part of our care plan now, the physicians and the physical therapists can be in almost constant communication, and that if there needs to be changes, and there needs to be changes now, the phones, it happens in an instant. So that argument, it doesn't hold water with physical therapists. I would argue that truly coordinated patient care isn't and shouldn't be driven by financial gain. Quality care should always be more important than profit-driven care. Thank you for the opportunity to join in this important event today. Our foremost goal is to see patients continue to receive the highest quality, most appropriate care while protecting limited Medicare resources. Narrowing the IOAS exception will ensure that both goals may be met without hurting true interdisciplinary collaboration. This is beneficial for seniors, healthcare providers, and taxpayers. Thank you.